everyone, and welcome back to my channel. If you're new here, welcome. My name is Crystal, and on this channel I share my tips, resources, and guidance on double jaw surgery in 2021 based on my double jaw surgery experience. In today's video, we're going to be talking about being 1 month post-op, my experience with that, my mental health journey, getting used to my new smile, my new bite, and my new look. And also we're going to be talking about the removal of my splint at my 6-week post-op. So let's get right into it. Okay guys, so as of today, I am 44 days post-op double jaw surgery. That's crazy. So I'm a little bit over a month and a half after my double jaw surgery. For those who are new here, I had a left fort 1 osteotomy with a sagittal split. So we moved my bottom jaw and my top jaw. And so being 1 month post-op, I wanted to wait a little bit longer to do this video because I wanted to wait until I got my splint removed at my last surgeon's appointment, which was my 6-week post-op visit with them. So that's actually my last appointment with my surgeon ever. And in that appointment, we removed the upper splint on the top of my jaw. So during my jaw surgery, what my problem was with my upper jaw was it was too wide before I had surgery. So when they went in for surgery, what they ended up doing was to make it more narrow. They cut it in the middle and put it back together. And in order to make sure that that healed correctly and properly, they put in a plastic splint on the roof of my mouth. And I'm gonna go ahead and put a picture in the video as well so you guys can see it. I do wanna give you guys a warning though that it is bloody, so it could be scary for some of us who are just starting our jaw surgery experience. So please be aware that that is coming up. And I'm also gonna be sharing my immediate reaction after getting the splint off after my appointment. And I do wanna let you guys know that that can be triggering for some people because I am pretty emotional in it. So in the splint removal process, like I said, it was pretty bloody, but I wanted to wait until it was off because it really feels like I'm over the hump now, and that really felt like the 1 month marker for me and for my personal jaw surgery journey. What I'm gonna do is I'm just gonna let you guys see my reaction after I got my splint removed. And if you guys have any questions, please feel free to drop them below. I know not everybody has a splint on the roof of their mouth. Not everybody has to have that procedure done on the top half of their mouth. So if you have any questions about that or that process, please let me know. Okay guys, so I just got to my surgeon's appointment. Of course, late, oh my gosh. But we're here to go get my splint removed. So I gotta go in there. They just called me in. So I will talk to you guys soon. Okay guys, so I just got out from getting my splint removed. You can see that there's like red, that's blood. Honestly, you guys, I feel so much better. Like my top jaw can from the inside breathe, but the whole experience in getting it off was, I wish I would not have gone alone. But it's not that it was painful because as you can see, I got numbed, I got the shot and then I did a lidocaine, but it was just scary, it's just I think it was just scary to do it alone. And then you still feel the pinching and the prodding. That's not to say that it wasn't a good experience. My surgeon was as gentle as she could be and was really considerate of me, but you have to open up your jaw a lot, and I haven't been able to do that in a long time. So it was hard. It was hard for me to do, but I'm happy. That sounds so weird, but I think I'm just emotional because now I get to see my orthodontist, and it's just all the process. It's all really normal. It's just I was a little bit scared. Had my splint on for 6 weeks. I haven't really been able to clean the top of my mouth for 6 weeks,
and when it came out, it was just it was bloody and yellowed and stained, and quite honestly, it smelled so bad. I don't know what I was expecting, because it's 6 weeks, you know, that you're eating, drinking, well, not really eating, but like eating as much as you can, and you don't really get in there very much. So I'm allowed to use my electric toothbrush. I'm allowed to use my water pick. I'm cleared to do everything, live life as normally. I can start eating solid foods again and start incorporating solids into my diet. Hallelujah. So we'll see how that goes, and I will show you guys my bite right now, being 6 weeks post-op.
So with my splint, I had wires that were twisted and tightened from the inside to make sure that that splint was staying in place. So I had 5 wires in total, all around the top of my jaw. And in that splint removal process, what they did was they went in with some clippers and then a tool that was to untighten the wire and then pull it out initially. And so it was kind of stressful because you have to open up your jaw a lot, and that's not something that I was able to do. I have been given the okay to start chewing and to start incorporating solid foods into my diet. With that being said, I do want to talk about how much my jaw can open at this point in recovery. So I can only open my jaw about this wide post-surgery at this point. My surgeon did let me know that to start stretching my jaw muscles by doing an exercise so using my index finger and my thumb, putting my thumb on the top teeth and my index finger on the bottom, and just pushing my jaw open, leaving it for a moment where I feel a big stretch, and then taking a 10 to 20 second break, and then doing it all over again. And I'll show you guys what that looks like. So the thumb and forefinger, and then giving it a rest. And I will also, oh my gosh, I will also show a video of me trying to eat a donut at 6 weeks post-op.
So at 6 weeks, this is kind of how eating is going. This is just a good example. The donut is super thick, and I can only open my mouth this much. It doesn't go in, so I have to break it down quite a bit and then just kind of stuff it in there. I'll just break this and then just like make it smaller pieces. Totally worth it. Worth it.
I don't have that range of mobility that I used to have before surgery. So I'm going to start really working on that. I also am going to be using some warm compresses to get those muscles warm and hopefully to get them feeling a little bit more like they can move. And I'm also going to be doing those jaw exercises, I feel like at least 3 times a day, just so that I'm on top of my mobility in my jaw. I don't want to have limited range of mobility moving forward into the future. So it's really important to get those things moving as much as you can when you are given the okay to do so, which you should always ask your surgeon when it is okay to start stretching your jaw, and consult your medical provider. A lot of questions about my mental health and kind of how I've been dealing with this entire process. I feel like this whole journey for me personally has been very up and down. So there has just been a lot of emotions, and the biggest thing that I have learned from it, not all the time are you going to be able to handle your emotions. You know, you're going to cry and be angry and upset and feel like you're not maybe healing fast enough, or you're not healing at a pace that's the same with others. And the biggest thing that I learned is to have patience and also give myself a bit of grace during this process. It's been difficult to look at myself in the mirror and to see something different and to get adjusted to this new way of living life. But I know that I am happy with the results. I knew that I would do the surgery again. It's been difficult to try to get to a point where I look at myself and I recognize myself, which I know is pretty common in this surgery and with other patients that I've talked to that have had this surgery. I look at myself and I almost don't recognize myself. I almost feel like, who is that? Like, I actually have defined cheekbones now that I never had before. And so my makeup routine has changed a little bit in that sense, but also seeing my reflection or seeing myself passing through, glass mirrors or doors has been a jarring experience. Like, my change has been very, very subtle, but from what I used to look like, and I'll put up a picture of that, and you can see it side by side, it's a big change. Ultimately, though, nobody really but me and like my family has really noticed that much of a change. Like I said, it's a really big readjustment. And now that I'm able to chew solids again, it's been even weirder. Like, I have never had a bite this way, so I almost feel like I don't know how to chew. It's crazy because it feels like something so basic that you have to relearn again. And that has been frustrating for me. I've lost about 15 pounds post-surgery, and that, I think, is accredited to the diet that I've been on, not being able to eat as much as I normally would. Overall, I'm trying to stay as positive as possible, and what really helps in that is to have a really strong support system. And that's something that I mentioned in week 1. Having a support system that is going to be there is going to be critical for your success, whether that be your medical team, your family, your friends. Having people that you can talk to about what it is that you're going through is huge, because you're just going through so much. You need to express that with someone. And so for me, my family, medical team, and friends have been that for me. It's also been really difficult not to be able to see my friends as much or feel like I can go out and do as much. We love to go out and have dinner together, have drinks, and that's just not something that I've been up to. And it's been over a month now, so that's been really difficult for me. So what we end up doing is more at-home stuff. They will come over and visit me, we'll go get ice cream together, do something that's enjoyable for us all. And they have been phenomenal for being there for me, as well as my family. Big shout out to my family and my support since day 1. Also, my medical team has been incredible. So every time that I had a question, felt that I was like not where I should be, called them and was able to talk to them, and they were always on site or had emergency medical staff, on the weekends that I could speak to when my bands would break or my stitches were falling out. It really brought me a lot of peace in mind and comfort. But in terms of my mental health, it also helped me to feel more secure in what was to be expected and how to move forward. But otherwise, I'm feeling really positive about the changes that I'm seeing. I'm feeling really confident in my journey, even though it is a lot of one day it's great and the other day it's not. I'm having more good days as I get further in my recovery and further in my journey. But like I said, in terms of my mental health, it's been a lot of this. And I just want to say, if that's where you are right now, that's absolutely normal. You be patient with yourself, have some grace for yourself as you're going through this process. It's going to be difficult. There are going to be days where you have so much energy and are feeling so great and are able to do a lot. And there are other days where you will be in pain. Your jaw muscles will be sore and you're just trying to get through the day, and that is normal too. It's all a process. And so before we end off and leave each other, I want to give you guys some words of encouragement. If you are 1 month post-op, please remember that you are doing the best that you can and you are going great. I am so proud of you that you have come so far in this recovery, that you are moving forward and making the necessary motions to take care of your health. And please, 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 if at any time you're feeling low, down, or starting to doubt the surgery, please reach out to a trusted friend, family member, or your surgeon. Please have those conversations and express those feelings. You will feel so much better. And we really want you guys to be taking care of your mental health during this time. So thanks so much for watching, and I'll talk to you guys soon.